Welcome to Understanding Coronavirus. Now, just a few months ago, we had never even heard of coronavirus. Now it's on everyone's lips as we all grapple with what it is, if we're at risk, and if we really are prepared to fight it. Good evening. I'm Jessica Aguirre. Now, over the next half hour, we'll take an in-depth look at the worldwide outbreak, how it started, and how it reached the Bay Area. We're also going to share with you practical advice, how to protect yourself and your family, and how to minimize your risk. And we'll answer questions and clear up common rumors and myths. And we're going to show you what's being done right here in the Bay Area to find a cure. First, where coronavirus came from. Janelle Wang has the timeline.
Guangdong, China, November 2002. Severe acute respiratory syndrome, or SARS. More than 8,000 people get sick worldwide. 774 of them died. We now know SARS was a virus and most likely spread to people from wild animals.
The health ministry has reported 8 new cases of
Saudi Arabia, 10 years later. This time, it's Middle East Respiratory Syndrome, or MERS. 2,500 people were infected and more than 850 died, a 35% death rate. And again, it spread to humans from animals, possibly camels.
The virus continues to spread here in Asia.
Wuhan, China, December 2019. Another viral illness, possibly originating in a wild animal. Known as the coronavirus, it's spreading at lightning speed.
We are now on the verge of reaching 100,000 confirmed cases.
The first death was reported in China on January 11th. 2 days later, the virus was reported in Thailand. By the end of the month, it was in at least 8 countries, including the U.S., with the first case in Washington state.
I'm thankful that the man who tested positive for this virus acted so quickly and sought treatment.
In February, coronavirus got an official name, COVID-19. Co for corona, V for virus, D for disease, and 19 for 2019, the year it first appeared.
On the balcony, we have to wear the mask.
The situation became a lot worse on February 4th when the virus hit a cruise ship in Japan. Some of the American passengers from the Diamond Princess were quarantined at Travis Air Force Base near Fairfield. There, they joined other American travelers from China who may have been exposed to the virus.
We're very grateful that, we got out of China when we did.
More outbreaks popped up around the globe with hotspots in Iran, Italy, and South Korea.
This is a growing concern. It is a growing, potentially pandemic.
On March 5th, the Bay Area took on its own coronavirus cruise ship crisis. Authorities learned passengers and crew on the Grand Princess, which sailed from San Francisco, were possibly exposed to COVID-19. A Sacramento area passenger on an earlier voyage had died after getting sick. Governor Newsom ordered the ship held off the San Mateo County coastline until passengers and crew are tested.
For a little more perspective on how quickly this virus is spreading, check out this animation. It started here in Wuhan, China, and you can see it growing and growing at the end of January into the beginning of March. It's basically spread to every single continent except Antarctica. Jessica?
Okay, thanks, Janelle. So now that we know what coronavirus is, how do you know if you have it? Well, coronavirus is a respiratory illness, and symptoms can range from mild to severe. Symptoms include a fever, a cough, and shortness of breath. Now, they usually appear anywhere from 2 days to 14 days after exposure. There are 3 main ways that you can catch the virus. One is having traveled overseas to an area where the virus is rapidly spreading. 2 is having had close contact with someone who already has coronavirus. And 3 is being exposed to someone with COVID-19 somewhere out there in the community. Now, Bay Area health officials say they've seen a rise in patients who've neither traveled nor had contact with an infected person. And that means the virus is out there, circulating among us. And that does sound scary, but there are ways that you can protect yourself. By now, you've probably heard it dozens of times. Wash your hands thoroughly. Soap and water, preferable, but if that's not handy, alcohol-based hand sanitizer can be used. Also, location. Bay Area Public Health Department say avoid visiting hospitals or nursing homes, even if you're okay. And if you do have to go, keep 6 feet away from patients and employees. If you're sick, call your doctor first. Don't go to the emergency room unless it really is an emergency. Another tip, stay away from places where there's lots of people. And if you're over 60 or you have an underlying health problem, the CDC says limit the amount of time you leave your house. Be good to yourself, get rest, eat healthy foods, manage your stress, and keep your immune system strong. And if you are well, the CDC says you do not need to wear a face mask. It may make you feel protective, but they're really more effective for people who have symptoms and need it for healthcare workers who are in close contact with other people. Now, because this information is changing regularly, you need to stay informed. Sign up for health alerts from public health websites or follow them on social media. Now, we just mentioned using hand sanitizer if you can't wash your hands. We found that a lot of people really aren't even using the hand sanitizer correctly. So we asked consumer investigator Chris Kimura to give us a little tutorial.
First, health experts agree that if you're given a choice between washing your hands and using antibacterial gel, you should wash your hands with soap and warm water for about 20 seconds. Now, if you can't get to a sink, hand sanitizer is better than nothing. But how much, how long, and what kind? Here's what the scientists at the University of Florida say. To be most effective, a dime-sized dollop of alcohol gel should be rubbed into the hands for 30 seconds. If hands are dry after only 10 or 15 seconds, it's likely not enough sanitizer was used. 30 seconds is a long time to rub your hands dry, and I want to show you exactly how long 30 seconds is. So we're going to put a clock on the screen to show you while I talk about alcohol content. The packaging should tell you how much alcohol is in the gel, and the experts say the higher the better, though the sweet spot is between 60 and 95% alcohol. They warn that the higher concentrations are actually not as effective. That's because there needs to be a little bit of water in there to cause the reaction that kills bacteria. And here we are, right at 30 seconds. My hands should finally be dry. That's a long 30 seconds.
Okay, thanks, Chris. Let's talk now about staying healthy and when you should call for help. Joining us now is Dr. Yvonne Maldonado. She's a professor at Stanford and an expert on infectious diseases. Thank you, doctor, for being with us. Let's start with the obvious. Have you seen an increase in people calling you, being worried about what they should do?
Yes, absolutely. We're starting to get more people who are concerned as we hear more in the news about cases in the U.S. and elsewhere.
So how do I know if I'm at home and I have a cold? At what point do I determine, okay, I have a cold? Or when do I figure maybe I have the coronavirus?
It's going to be really hard to know because we don't really know the range of symptoms for the coronavirus, but it appears that many people will have very mild symptoms.
So when we've been telling people here in the news that one of the protocols you're supposed to follow is that you're supposed to call your regular doctor. What happens when you call the doctor? What's the protocol that happens after that?
Well, so the doctor will probably ask you a series of questions. They'll ask you, first of all, have you been traveling to any areas that are considered high risk? Have you been around anybody else who has traveled? Have you been around other people who are sick or other risk factors? They might ask you if you have underlying disease like heart disease, asthma, things like that. They'll ask you what your symptoms are. And if they think that you are sick, not sick enough to come into the clinic, but you might have a mild respiratory illness, they might ask you to stay home, take Tylenol or Advil for pain relief, hydrate, and rest. Make sure, again, you get lots of rest. And they will also give you a list of things to watch out for. So that would be things like, worsening fever, worsening symptoms, again, inability to drink water or other liquids, just feeling worse. And at that point, they might ask you to come in and they will evaluate you in person.
So at what point do you make the determination to get the CDC involved?
Oh, the CDC has really pushed out a lot of their information to the local and state level as well as to providers. So they're really not involved on a daily basis with any of this. I think right now CDC is dealing with things like cruise shipping investigations and putting out guidance for all of us who see patients or who work running hospitals.
Okay, so when you say people with underlying medical conditions, we've been talking about the elderly, but we've also been talking about people with respiratory issues. What is the gamut with that? Are we talking about just people with emphysema, or are we talking about people with asthma? And are we talking about children with asthma, or is it just elderly people with respiratory issues?
Well, so far what we have seen, and again, the data aren't complete because it's evolving, but we think that the highest risk group for severe disease and especially for death are older people, that is maybe people over 70 years of age, certainly over 80, people who have heart disease, diabetes, kidney disease, asthma could be one risk factor as well. It seems like children and young adults have not been getting as sick, at least from the preliminary observations that we've heard from Asia, parts of Asia, and some observations here in the U.S. as well.
And finally, Dr. Maldonado, could you give us some words to kind of appease us a little bit of the panic that is starting to spread? What words of caution could you give us?
Well, I think we need to remember that there are other respiratory viruses that also cause severe illness. We know that influenza causes severe disease. And what we need to know is that this is probably it's a cold virus, so we know that you need to practice the same kind of etiquette that you do with other respiratory viruses. Keep yourself, hand sanitize, wash your hands. Don't touch other surfaces unless you've cleaned them up if you're in a group with large groups of people. Stay away from people who are coughing or who are sick. And if you yourself are sick, don't go into large crowds. So really, I think those are the major things. If you're going to travel, make sure that you check ahead of time to see if there's any evidence of large areas where there might be disease before you go traveling.
Okay, we appreciate you taking the time to talk to us. Thank you very much. Coming up, a run on supplies. We look at what you actually need to stock up on if you're told to self-quarantine.
And I'm Abby Fernandez in the Coronavirus Crisis Center. I'll answer some of the most common questions you have about the coronavirus. Plus, I'm going to tell you about some myths circulating around the internet.
Tried buying antibacterial wipes? Well, good luck with that. You probably ran into this: empty store shelves. People making a run on items like hand sanitizer and soap, but toilet paper? So what do you actually need if you have to self-isolate? That actually could happen if you come into contact with someone who's infected with coronavirus. You would be asked to self-quarantine for 14 days. So it may be a good idea to make sure your home is stocked up with the right things. You're going to need foods that can last on your shelf. Canned items are a great choice: beans, ravioli, fish, soups, also some dry foods like cereal, oatmeal, jerky, rice, pasta. Frozen fruit and veggies, same with frozen meals. Those are good ideas. If you buy meats and chicken, those should go in the freezer as well. Now, aside from food, you may want to get some painkillers and cold medicine to help you deal with some of those symptoms. Now, along with a good supply of any daily medications you have to take as well, you should stock up on those. And make sure you get the regular stuff: toilet paper, paper towels, other cleaning supplies, but you don't have to hoard. Remember, it's 2 weeks. It's not forever. Now, if you go on social media, you'll likely see a flurry of stories about the coronavirus, but not everything you see or read is true. So we created the Coronavirus Crisis Center to kind of sort out fact from fiction. Abby Fernandez joins us now to answer some of those questions. Abby.
Yeah, we're hearing a lot of contradictory information online about the novel coronavirus. So let's go through a few common questions and focus on the facts, not fear. The first question here: can home remedies cure or prevent it? Well, there is no scientific evidence that home remedies like taking vitamin C, eating lots of garlic, or using essential oils will protect you. Experts say the best way to prevent contracting coronavirus is to treat it like you would during flu season. Wash your hands with soap and hot water for at least 20 seconds. Sneeze and cough into your elbow, and stay away from people if you feel sick. Another popular question: is the coronavirus man-made? This theory has been going around the internet, but it's not true, guys. Scientists both in China and the West dismissed theories that COVID-19 was made in a lab. In reality, experts are still trying to figure out the exact source. And last question here: will the coronavirus be gone in the next few months? A lot of people are wondering this. A CDC director says she's hopeful the number of people contracting the virus goes down as the weather warms up, but that's premature thinking, she says. Like the common cold and flu, COVID-19 spreads through respiratory droplets. Most viral respiratory diseases spread more during the colder months, but you can still get sick from them during warmer months. If you guys want to hear more of these questions answered by a health expert, head over to our website, NBCBayArea.com. The full interview is online right now.
Okay, thanks, Abby. Still to come, canceling travel plans because of the coronavirus. We're going to look into what your refund options are if you do decide to stay home and whether protecting your vacation with travel insurance is actually worth it. Well, it's not just a health scare, it's a vacation scare, too. The coronavirus is proving to be an expensive disruption for millions of travelers worldwide. Some airlines are promising to waive cancellation and change fees, but not every company is on board. Consumer investigator Chris Kimura is back with a look at what your options are if you do have to cancel your trip.
Vietnam. That's where Hip Nguyen and his family are supposed to be right now.
The outbreak and spread.
But when the coronavirus outbreak recently exploded,
coronavirus has now spread to 26 countries.
Hip decided that staying home in Milpitas was safer.
Not too much about that. I'm going to get the disease, but I'm just afraid that being quarantined.
More than 230 people evacuated from Wuhan, China were quarantined at Travis Air Base in Fairfield, and thousands of others have been forced to stay aboard cruise ships.
We could probably speak for the rest of the cruise ship passengers when we say that we're all frustrated.
You're afraid of getting stuck over there?
Oh, absolutely.
So Hip expected EVA Airways to let him cancel his trip and get a full refund, especially since his flight was connecting in Taiwan, just offshore of mainland China. EVA said Hip was making a voluntary change and charged him a $200 penalty per ticket, $600 in total. EVA's website says it's only offering refunds for flights to mainland China. I asked Hip if he wished he'd bought travel insurance.
Absolutely. Yeah, I don't want to lose money.
A lot of travel agents and airlines hype up trip protection. Oftentimes, you can't even complete a booking unless you say yes or no to trip insurance. And take a look at this website. It tells me to join 2,483 smart customers who bought trip protection in just the past 24 hours. But not everyone is convinced trip protection is such a savvy buy.
They use words like total protection, protect your trip, but they're not really upfront disclosing that there's a long list of exclusions.
Kevin Brassler is with Consumers Checkbook, a group that writes reviews and does undercover price research. Brassler says most travel insurance excludes coronavirus.
The policies sold by airlines and the policies sold by most travel booking sites don't cover you for pandemics, for epidemics, and for lots of other things you'd expect them to cover you for: earthquakes, terrorist acts, wars, hurricanes.
We contacted the U.S. Travel Insurance Association, but did not get a response. Nationwide, our NBC and Telemundo response teams have received more than 300 travel insurance complaints that often hinge on people not understanding the exclusions. Some third-party insurance companies offer a higher level of coverage that will let you cancel a trip for any reason.
Our phones have been ringing off the hook from travelers who really have concerns over this coronavirus.
Julie Lafreddy is with Insure My Trip. She says sales of cancel for any reason policies have soared 60% since coronavirus started spreading.
You may end up paying a little bit more for that cancel for any reason coverage, but it certainly is what travelers are looking for at the moment.
How much more? It depends on the price of your trip and how far in advance you buy coverage. We got a quote for a cruise for a family of 4 valued at $5,000. Regular trip insurance was $144. A cancel at any time policy was $563.
I think you really have to carefully consider whether or not the premiums that you're going to pay for that type of coverage are worth their cost.
Something to think about. That was Chris Kimura reporting. Bottom line is protect yourself by always reading a policy before you buy it. Read that fine print. Coming up, working to solve the coronavirus crisis, how Silicon Valley companies are teaming up to stop its spread. Well, from developing faster tests to trying to find a cure, a lot of important work is happening right here in the Bay Area when it comes to the coronavirus. Our business and tech reporter, Scott Budman, is keeping track of all the developments. He joins us with a look at the research.
Jessica, biotech firms here in the Bay Area tend to be smaller than the East Coast companies and can move faster. So when it comes to finding a coronavirus vaccine, local companies are leading the charge. This lab in Richmond is busy these days, one of a handful across the state testing for the coronavirus. Results are ready within 2 days, but could that turnaround be even faster? Mammoth Biosciences in South San Francisco is trying to find out. Scientists there are developing this handheld disposable device.
We are working towards is a turnaround time within hours, so certainly in minutes is the ultimate goal.
Mammoth is hoping to get the test ready in the coming months. Other companies, meanwhile, are working on a vaccine. Atom Bio in Newark is helping by making computer-created copies of coronavirus.
So we build virtual models first in a computer and identify different properties of the coronavirus.
Those copies will be used by other biotech companies to develop a vaccine. Companies like Gilead Sciences in Foster City and Vir Bio in San Francisco.
Everybody feels the threat.
Inside the lab, you can feel this is important work. The San Francisco company trying to isolate antibodies, part of a wide effort to come up with a cure for the fast-moving coronavirus.
Everybody understands the urgency and everybody recognizes the potential pandemic nature of this particular virus.
Another note, this from Stanford University, which says a health lab has developed its own in-house test for the coronavirus, currently in use on Stanford patients. Jessica?
That is reassuring. Thanks, Scott. Now, our commitment to giving you the best and the most up-to-date information about this outbreak does not end here. In the coming days and weeks, we're going to continue to bring you critical updates to help you and your family. We are in this together. Now, you can also head to NBCBayArea.com. We've devoted an entire section to the coronavirus. It's a quick way to reach it. Use the QR code on the bottom left of your screen. All you have to do is point your camera on the phone to that code, and it'll take you right to the coronavirus page. Thank you for joining us. Stay healthy. Good night.